The rollout of coronavirus vaccines to kids under the age of 5 will take a bit longer than hoped. Pfizer says the two-dose regimen of its COVID-19 vaccine for children did not prove adequate protection for 2, 3, and 4-year-olds. The company is now testing a third dose for children. An additional pediatric dose would be given roughly 2 months after a child received their second immunization. If the trial is successful, Pfizer will submit the findings to health regulators early next year. The announcement comes as health officials fear Omicron will become the nation's most dominant coronavirus variant in the coming weeks. The highly contagious strain has been found in at least 40 states. It was first identified in California earlier this month. Cases of coronavirus are surging nationwide. Infections are being reported among vaccinated and unvaccinated Americans. More than 60% of the country has at least 2 doses, which the CDC considers fully vaccinated. About 30% of Americans have received a booster. The CDC is urging the public to go out and get their shots ahead of the holidays.
If you are vaccinated, you could test positive. But if you do get COVID, your case will likely be asymptomatic or mild. We are intent on not letting Omicron disrupt work and school for the vaccinated. We've done the right thing, and we will get through this. For the unvaccinated, you're looking at a winter of severe illness and death. For yourselves, your families, and the hospitals you may soon overwhelm.
The CDC is no longer recommending the Johnson & Johnson one-dose vaccine. It's been linked to an extremely rare blood clotting condition. Instead, the advisory panel is suggesting the use of mRNA vaccines like Pfizer and Moderna. Dr. Len Horovitz joins us now for more on this. He is a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you so much for joining us. The CDC advisory panel is discouraging the use of the Johnson & Johnson vaccine after linking it to a rare blood clotting condition. If this condition is so rare, why is the panel expressing such concern?
The incidence of this complication was about 1 in 100,000 in women, almost exclusively in women aged 30 to 49. Even 1 in 100,000 is a significant number of cases. And several of them were fatal cases involving the cerebral circulation. So that is the reason for preferring the other 2 vaccines over J&J.
So what does this mean for the roughly 16 million fully vaccinated Americans who already received the J&J vaccine?
The 16 million Americans who received J&J should be boosted. And the recommendation was that they be boosted within 2 months of receiving J&J with either Moderna or Pfizer. And they're interchangeable as far as the choice of the patient or what's available. There is plenty of available vaccine for Moderna and Pfizer at the present time.
And so you're saying that they should get boosted. We're seeing a spike in newly confirmed cases. What is driving this latest surge?
The fact that only 30% of Americans are boosted is a problem. We know that Omicron, for instance, is not given good coverage with only 2 doses of the vaccine, and that is why Dr. Fauci and the CDC have recommended boosters for just about everybody who's been vaccinated. So 3 doses of the mRNA vaccine would be indicated for these people. Even a third dose of booster doesn't necessarily confer complete immunity, but it does prevent hospitalization and death. And the metric we're watching now, of course, is hospitalization.
Now, the Delta variant remains the dominant strain in the U.S. Does this suggest the vaccine's efficacy is waning and Americans are slow to receive their booster shots?
We know that vaccines wane after about 6 months, which is why the booster plan was always in effect. The fact is that with Omicron, 2 doses do seem less protective to that particular virus variant than to the Delta variant. And so boosting is incredibly important right now going into the holidays, where we always see a surge in cases because of indoor activity in the winter months.
Well, with the holiday season being here, New Year's is just around the corner. How should Americans navigate the holidays to stay safe?
We have to remember, of course, vaccination is paramount, boosting whenever possible. And of course, the public health measures that we've all become familiar with, masking, social distancing, hand washing, watching the ventilation and the spaces that you gather in is very important. And of course, if it's possible, at-home testing would be a great idea for people who plan to gather and want to test that day. There are tests available in pharmacies that are antigen tests that will give some assurance that a gathering can take place with everybody testing that day and testing negative.
All great things to keep in mind. Dr. Horovitz, thank you so much.
Thanks for having me.